Hey everybody, Dr. Barron here with virtualheadachespecialist.com. I thought this was a good question about sinus headache always on one side. And so, sinus headache is a very common term we see in the headache center. Almost always, it's not actually a sinus related problem. The International Classification of Headache Disorders doesn't even recognize sinus headache as a real term. And you certainly can have, if you have a sinus infection, fluid, pus, fever, drainage, that can certainly cause some pain in the sinus areas. But surprisingly, the vast majority of sinus headache is actually migraine. There's been a couple studies looking at this actually, and 95 plus percent of all patients that have a diagnosis, either self-diagnosed or doctor diagnosed sinus headache, turned out to be migraine. And so the reason for this is migraine. The source of migraine comes from the trigeminal nerves. The trigeminal nerves innervate throughout the head, the face, the teeth, the sinus cavities, the TMJ areas. You can get different manifestations of pain in these areas and symptoms in these areas with migraine. So for a lot of people, their migraines cause very prominent sinus symptoms: pressure, congestion, pressure through the face, the sinus cavities above the eyes, below the eyes, through the face. And they go for years treating this as sinus headache. I've seen a lot of people that have had a ton of sinus surgeries. It never helps. When you treat it as migraine, it actually gets better. So if you have sinus headaches, quote unquote sinus headaches, and there's any throbbing to it, if there's any nausea, if there's any sensitivity to light or sound, it should really be treated as migraine because that's what it fits criteria for. Migraine, as you know, criteria is that it's often a one-sided headache, so you can get sinus symptoms on one side with the pain. There's also a set of headache disorders called the trigeminal autonomic cephalalgias, the TAC syndromes. There are 4 of these. I'll talk about these in a different video, but they are hemicrania continua, paroxysmal hemicrania, SUNCT/SUNA, and cluster headache. These are all one-sided headache with sinus symptoms: pressure, congestion, drainage, red eye, runny eye. Again, different topic, but those can also cause sinus symptoms on one side as well. So it really comes down to the duration, the character, the pattern of the headache, and the pain that's associated with the sinus symptoms to know what classification it's going to fall under. So anyway, just wanted to mention that, guys. Drop questions if you have any. All right, see ya.